one of the really important voices who has been tirelessly working to help make sure that we have a world where ovarian cancer survivors can thrive, is Dr. Meredith Mistifer. And I'd like to give just a little bit of introduction to her. She's a licensed clinical psychologist for the Federal Bureau of Prisons. She served as the chairman of the board of directors for the National Ovarian Cancer Coalition since 2018 and is now director emeritus. She's presented and published research on perceived partner adaptation during a cancer diagnosis, and also speaks publicly on vicarious trauma, transformational leadership, and ovarian cancer thrivership. She enjoys writing for Brighter magazine and participating in endurance events. Whew, all right, I'm in awe. For the NOCC Team Teal through hiking and cycling. So with that introduction, Meredith, please come up and take the podium.
Good morning, good afternoon. Before I was ever a cancer patient, I was a psychology doctoral student, a wife, and a woman trying to become a mom. For years, I experienced infertility, doctor visits, disappointment, waiting, and a lot of hoping. So when I finally decided to pursue fertility treatment, I thought I was stepping into possibility. But minutes before the procedure, an unknown mass was found. And honestly, I wasn't immediately alarmed because I had history. I had ovarian cyst ruptures, I had endometriosis, I had surgery since I was 19 years old, of being told or at least feeling, maybe this is all in my head. So I thought, this is just my body doing what it's always done. So I waited. A month later, the mass had tripled in size. Surgery was recommended immediately. Cancer, I asked? 5% chance. Don't worry about it, they said. I remember sitting on the exam table, you know, that paper so nicely crinkling beneath you, hearing the words like mass and surgery, and still thinking this is probably nothing, because sometimes denial is the only things that can be managed in the moment. And then came the wonderful surgery pre-op appointment. You know, the forms, the risk, the place where you sign your name acknowledging that, you know, what could possibly go wrong, but hopefully won't. And then one more routine step. We're gonna need a urine sample. We need to make sure you're not pregnant before the surgery tomorrow. Well, I think that's highly unlikely. It's been years, I remember thinking. But sure, I'll follow and obey the process. And then everything changed. The room got quiet, the nurses looked different, and I was told, Meredith, you are naturally pregnant. I have no idea how that happened in that month. And then I was given two options: terminate the pregnancy and proceed with the surgery the next day, or wait until I was 4 months along. Again, I chose to wait. Because in that moment, no one could give me a clear answer. There was no research, there was no plan. Even after a second opinion at Johns Hopkins, the message was the same. The decision was mine. And deep down, I knew this might be my only chance to become a mom. So I waited. At 4 months pregnant, I had extensive surgery. I woke up with 36 staples down my abdomen. I woke up, thankfully, still pregnant. And I woke up hearing that the mass ruptured upon removal, spreading its contents inside me, and that they did the best they could. 5 days later, labs at Mass General confirmed that I had clear cell ovarian cancer at the age of 30 while 4 months pregnant. Clear cell is a rare aggressive form of ovarian cancer that does not typically respond well to frontline treatment. And I remember thinking, how can something so life-giving as a child and something so life-threatening as the deadliest gynecological cancer, how could they exist in my body at the same time? And just like that, I was back in a place of impossible decisions. I made another choice. I chose to delay all treatment until after I delivered my baby. Not because it was safe, and certainly not because it was recommended, but because there was no research at that time to tell me what would happen to me or what might happen to my unborn child. And I want to pause here because this matters for all of you. The hardest part of my story was not my diagnosis. It was the absence of answers. The silence where research should have been, the uncertainty where guidance should have been. I remember thinking, how can there be no plan? How can this be up to me to just do what I think is best? And then there were those moments where I didn't feel really heard. Moments where the focus was more about my medical complexity, but not always on the human, or shall I say, humans that were in front of them. I wasn't just a case, I was a pregnant woman, a mother trying to make decisions that could cost me my life or my child's. And when you're in that space, we don't know doesn't feel clinical. It feels like you're standing on the edge of something with nothing to hold on to. My world felt out of control. This wasn't certainly the future I had imagined. This wasn't in the plans. And all I was left to were my instincts. Every day I asked myself during my pregnancy, did I make the right decision? Is this one I'm going to regret? Am I protecting or hurting my baby? Am I risking my future to raise the baby? That's what uncertainty looks like for patients. It's not theoretical, it's lived, moment by moment, with no guarantee that we're getting it right. Nothing in my life, nothing, has been harder than that decision. Not surgery, not treatment, not anything. And after my son was born, I faced more surgeries, more staging, and a year of chemotherapy. And at the same time, I learned that in sickness and health doesn't always hold. The waves were big, but I didn't drown. I adapted, I endured, because sometimes you don't have a choice. You just do hard things. And for me, it worked. But I need you to hear this clearly. The outcome did not come from certainty. It came in spite of it. Because ovarian cancer still has no cure. Even now, patients are still navigating fear, recurrences, trials, and unknowns. You don't finish this disease, you carry it. But I also experienced something powerful along the way. There were moments when I truly felt heard. Moments when my provider slowed down, looked me in the eye, and truly listened. And those moments, they didn't change my diagnosis, but they certainly changed how I carried it. Because when patients feel seen and they feel heard, we don't just feel treated, we actually feel human again. So you can't imagine the power of that simple gesture. Out of all of this, I found strength, or more likely resilience, not the kind that looks fearless, but the kind that keeps moving you forward, even when you're scared shitless. I learned to trust myself, to advocate, and to use my voice, because I never wanted anyone else to sit in the same silence that I did. So that's when I turned my pain into purpose. I began using my voice, speaking publicly, advocating on Capitol Hill for research funding, serving as a consumer advocate for the Department of Defense research grants, and educating future physicians right here at the U of A, where they remember the stories instead of relying on checked boxes for a diagnosis. As Dr. Barton said, I've also proudly served as the chairman of the board of directors for the National Ovarian Cancer Coalition for 7 years. The most healing purpose, however, I found is through their endurance platform called Team Teal. It gave me a way to not just survive, but thrive. What does thriving look like? Well, in 2023, it looked like me and that baby summiting Mount Kilimanjaro in Africa, cycling 4 metric centuries following, a teal takeover at the Peloton studio in New York, completing my first, and may I add, last ever marathon in Dublin with my new and improved husband. And now we are preparing to summit 5 peaks in Peru, ranging 15 to 17,000 feet in elevation this July, all while taking ovarian cancer awareness to new heights. Not because those things are easy, but because awareness isn't passive. It takes movement, it takes visibility, it takes voices. And through these efforts, we raise critical funding for research, for patient programs, for resources that help people navigate what I once had to face alone. Because the goal is simple. We need a better tomorrow and a future where no woman dies of ovarian cancer. So everything we do out there, the mountains, the bikes, the race courses, it connects directly back to what you are doing right here. So I'm going to ask you something. When you're deep in your work, you're in that lab in the basement, do you ever stop and picture the person on the other side of it? I hope you do now. But my story doesn't end there. That baby I chose to fight for, he's 23, and now he's the one in a research lab. My son Ryan graduated from the U of A with a degree in biomedical engineering, working under Dr. Jennifer Barton, and is now a first-year PhD student here, continuing that path. Bear down. And if life wasn't already full circle enough, he's working on a tool called the falloposcope, which may become the first and only early detection tool for ovarian cancer. Proud doesn't even begin to cover it for this mom, right? But it also brings a sense of validation for the decisions I had to make in one of the darkest moments of my life. But more than that, it reminds me what's possible when science moves forward, when research evolves, and when questions may finally get answers. So I want to leave you with this. When you're in your labs, analyzing data, designing studies, I want you to remember that your work is not abstract. It is deeply, profoundly human. It's for patients like me sitting in rooms on crinkly paper sheets, making impossible decisions and waiting for answers that don't exist yet. If there had been more research when I was diagnosed, my story might have felt less uncertainty and more like direction. You may never meet the patients your work impacts, but I promise you, we feel it. In the answers we have and in the ones we're still waiting for. So please keep going, keep asking the hard questions, keep pushing forward, because behind every data point is a life. Someone like me, or someone still hoping that the next answer comes soon because they don't have the luxury of waiting. No pressure, but we're counting on you. Thank you for having me here today.
Thank you, Meredith.
Yes.
That was amazing.
Thank you.
Oh, wow. So you've shared that you dealt with symptoms for years before your diagnosis. And when you think about women today who might be in a similar situation, who they're brushing off symptoms, they feel themselves, or they feel like they're not being heard, what would you like to tell them?
Well, I think as women, we're great at multitasking, but we're not very good at taking care of ourselves, or we push it off, or we think we can wait. But I think everyone here in this room, we know our bodies best. And I think we need to keep sharing those symptoms with somebody that will listen and advocate for ourselves. And if that person is not listening, then we need to get a second opinion.
Agreed. And so as both a clinical psychologist and a long-term survivor, you really bring a unique perspective. So from your experience, what do you think researchers and clinicians sometimes overlook when it comes to the emotional or psychological side of what patients and families go through? Really, what can we do better?
Well, I think a lot of people, even family members, sometimes see survivorship as the finish line, and it is not, right? Sometimes the phase after survivorship can be even harder than the treatment that we're going through, because at least we have physicians and people watching us. But like when they say, okay, you're done, no evidence of disease, I hope you don't recur, and then you're just supposed to go home and reemerge into this life that's now forever changed, right? So I think we have to recreate a sense, I think people need to know that we're constantly recreating a sense of safety in our own bodies. Things shift, relationships change, friendships may change, or just the way we look at life changes. So I think they need to know that there's not a finish line. It's constantly evolving.
That's really
and to be
important.
mindful of that, yeah.
Wow, that's a great way to think about it. So this has changed you forever, and you found ways of not only helping yourself, but help other people. So maybe could you tell us just a little bit more about NOCC? And I know there's many organizations like that for other diseases. And what have you particularly benefited from, and what would you recommend to other survivors?
So I came across NOCC by a bunch of friends that thought I was depressed and sad and needed to get out, which as a good psychologist, I think isolation was doing me just fine. And they were like, no, we're going to take you to this run walk in Philadelphia. That's where I'm from. And I was pushing Ryan in the baby stroller, and I really didn't want to go out. I mean, it's like a gym. It's not really a membership you want to be part of, right? So I went there and I listened to someone share their story. And in that moment, that I think is what changed me with NOCC, was that I was empowered by listening to that story and not feeling alone anymore. And so now when I talk to survivors who do or don't want to really share their story, I share with them that, like, you don't know who you're going to impact by sharing that story. I don't know, from there it just kind of went to a lot of volunteering with them. We provide programs and community support, as well as funds research, new researchers, innovative and creative research for ovarian cancer. So that's what the organization does, and it kind of meets the survivor where they're at now. So we have financial assistance. As we know, it's hard for people, sometimes people are choosing to pay their gas bill instead of traveling to a clinical trial because that's too expensive. So we offer financial resources. We offer free meals to the survivor and the caregiver, because we've got to take better care of those caregivers. They're the ones, God bless my parents, they took care of me. There's nothing more humbling than moving back in with your parents with a newborn as a single parent and going through treatment. So we need to take care of the caregivers and then just continue on with research so that we can find a cure.
Thank you. And finally, just last question. So how can advocates like you and tool builders like me work together more effectively?
Well, I think you keep doing what you're doing, Jennifer. Like we really need that early detection tool, because that would be such a shift in outcomes for ovarian cancer, for sure, if we had something that could detect ovarian cancer. But I think as patients and researchers, things like this, as well as just always kind of being invited to the same table, I can share what it feels like and you can tell me what's possible, and I think that's the best outcome we can ever expect when we work together and collaborate like that.
Oh, fantastic. Thank you so much.
Thank you.
All right.